Welcome, everyone, to today's media information session hosted by the Haliburton Kawartha Pine Ridge District Health Unit. We're really glad that everyone could join us and hope you're enjoying a very relaxing summer. It's certainly not been relaxing the last few days given the various health issues that have come up, so I think this is a timely opportunity for Dr. Bocking, our Medical Officer of Health, to provide some updates on important health issues, not just COVID, and for the media to have an opportunity to ask questions. As we have always done, we'll have Dr. Bocking say a few opening remarks, after which we'll open it up to questions from the media. If you can limit your first question and a follow-up, and then once everybody's had a turn, then we can open it up to others. So my name is Bill Eekhoff and welcome you here today. We will have a recording of this available afterwards on our YouTube channel. Without further ado, I'm going to turn it over to Dr. Natalie Bocking.
Okay, hi there, Bill. Can you see me and hear me?
Yes, you're coming in clearly.
Okay, perfect. Good afternoon, everyone. As Bill mentioned, my name's Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit. Thanks for joining our session today. I know it's been a couple of weeks, so happy to provide these updates. I'll start with some updates related to COVID-19, and then I will provide a couple of updates related to monkeypox infections, and then certainly open to answering any questions to the best of my ability. So related to COVID-19, we know that provincially there's some indicators that the 7th wave might be plateauing. Locally, we're still seeing an increase in COVID-19 activity, and I anticipate that we will continue to see an increase in activity for the next 2 to 3 weeks. We tend to be a couple of weeks behind the larger urban centers, given that we're a more rural region. And so we have been lagging a couple of weeks behind in some of these indicators. Certainly the indicators that we have right now do indicate increasing activity in the community. The number of new lab confirmed cases that were identified in the last 7 days has increased compared to previous weeks. The last 7 days, we've had 120 new lab confirmed cases reported. The number of outbreaks that we're following due to COVID-19 has increased up to 11 outbreaks, with 7 of those in long-term care homes or retirement homes. Just to put that number in context, in comparison to the 6th wave, or the last wave, if that's still in people's more recent memory, we were managing 23 COVID-19 outbreaks really at the height of that wave. So 11 is on the way up there, not quite 23, but certainly higher than what we'd seen in the last couple of weeks. Our test positivity is also increasing. It's crept up to 14%, which is around the provincial average now. There are some other regions in the province that are seeing upwards of 19 to 20%. And I think we should expect our test positivity to still continue to increase for another couple of weeks before plateauing. Now, our wastewater surveillance data is also demonstrating an increase, although not as dramatic as what we saw in the last wave. The Lindsay sewer shed viral signal has increased slightly, although is not as high as it has been recorded previously in either the 6th wave or the 5th wave. The sewer shed, the viral signal in the sewer shed for Cobourg, however, has increased more dramatically. It's not as high as it was during the 6th wave, or this last wave, but it has actually surpassed the peak of the viral signal for the first Omicron wave, or the 5th wave, or the wave, if you remember in your distant memory, just this past January in 2022. So the Cobourg viral signal is certainly increasing a little bit more. We're pleased to share that we will start posting the viral signal for the Minden sewer shed on our website. I understand that should be going up today, with the province recently expanding the number of sites they were supporting to continue to monitor for COVID-19. And the Minden sewer shed viral signal also increasing slightly, although not a dramatic increase at this point in time. I think the most concerning indicator over the last couple of weeks has been the number of hospital admissions that we've noted. So in the last 7 days, there have been 8 new hospital admissions due to COVID-19. This is an increase over previous weekly numbers. In the last 2 weeks, we've seen 11 new hospital admissions in total due to COVID-19. So I think similar to the message that was shared during the last 2 Omicron waves is that although Omicron does not necessarily cause more severe illness, the fact that it is so infectious, resulting in a higher number of absolute infections, we're going to see more hospital admissions. And certainly this is coming at a time where most, I think, public health units, hospitals, emergency departments usually experience a I guess, a downturn in activity. Summer tends to be a slightly quieter time. And certainly, as you've seen from provincial media, other media, our acute care partners are not experiencing a downtime during this summer, and certainly will feel some stress associated with increased COVID-19 hospital admissions throughout the region. So really, I think the key message for today related to COVID-19 activity is that we are still in the 7th wave, driven by the Omicron BA.5 subvariant. Our message in terms of what you can do as individuals and what we can do as a community remains consistent. Stay up to date with your COVID-19 vaccinations. If you're sick, to stay home. If you have symptoms of COVID-19 and have access to a rapid antigen test, then please do a rapid antigen test. If it's positive, follow the isolation guidance from the province related to staying at home until your COVID infection resolves. If your rapid antigen test is negative, don't assume that that's a true negative. Repeat the test in 48 to 72 hours later to see whether or not it's still negative or whether it is actually positive. Given the increase in COVID-19 activity that we are seeing across the region, I strongly recommend that people wear a well-fitted or tight-fitting mask in indoor public spaces where distancing can't be maintained, especially crowded locations that are indoors. I recommend that people reevaluate what social gatherings they are attending. I recognize that summer is a really important time to connect with friends and family. So look at ways that you can do that while still maintaining some precautions for COVID-19, or at least being aware of what precautions you can take to not only protect yourself, but your loved ones and friends that might be at higher risk of developing severe COVID-19. I would recommend, certainly if you're at higher risk of severe COVID, to wear a well-fitted mask in outdoor crowded gatherings as well, to minimize the risk of COVID-19. So coming back to vaccination, I know there's been a couple of updates over the last couple of weeks. There haven't been any recent announcements related to eligibility for second booster doses, so this still remains the same. I know that I continue to hear whether or not people that are eligible for their second booster dose and haven't gotten it, whether or not they should get it now or whether or not they should wait until the fall to get that second booster dose. As we know, we're expecting another wave of COVID-19 in the fall, and there may or may not be vaccines that might offer better protection against Omicron subvariants. For people that are at higher risk of developing severe COVID, so if advanced age, especially over age 60, where it is strongly recommended, and for individuals with medical conditions that compromise your immune system, strongly recommend that you get your second booster dose now, given the amount of COVID-19 activity we are seeing now across HKPR jurisdiction and the uptick that we're seeing in hospital admissions due to COVID-19. I think it's fair to say that their risk of acquiring COVID-19 now across this region is higher than before, and so the benefits of receiving that second booster dose now likely outweigh the benefits of waiting until the fall. I do, in terms of our recent numbers, we know that 44% of individuals that are age 60 and over have received their second booster dose, which means that if I can do my math right, 56% are still eligible for that second booster dose among those that are age 60 and over. So lots of opportunity to access vaccine. There's a number of GoVax clinics that will be continuing throughout the month of August. There are clinics that are hosted also at the health unit, pharmacies still offering COVID-19 vaccine, and many primary care practices also offering COVID-19 vaccine. The other big announcement, as I'm sure everyone has followed, was the announcement of approval of the Moderna vaccine for children aged 6 months to 5 years of age. So on July 14th, this was approved by Health Canada, which was then accompanied by a statement by the National Advisory Committee on Immunization. And as of last Thursday, the province of Ontario had made this vaccine available to children starting in Ontario. We do know that there are a number of opportunities or ways to access the Moderna Spikevax vaccine for this age group. Your first stop really would be your primary care provider. If your primary care provider is not offering COVID-19 vaccine at this time, or you don't have a family doctor or nurse practitioner, then you can also contact a health unit, as we also offer clinics and still have appointments that are open for the month of August. I know certainly as a parent of young children, that decision whether to vaccinate young children is an important one, and one that parents will consider, I think, very deeply and want to ensure that they have thought about all of the risks and benefits associated with a new vaccine. I did want to caution people that I've heard many people say that COVID-19 does not cause severe illness in young children. And while that is likely true for the majority of children in this age group, we are still seeing some severe illness in this age group, and more than in older children. In Ontario and in HKPR jurisdiction, if we look at the graph of hospital admissions by age group, we see what looks like a bit of a J, with a higher hospital admission rate in the much younger age group, dips back down among older children and adolescents, and then increases back up with older advancing age. Just in HKPR jurisdiction alone, since January of this year, we have had 9 hospital admissions among this age group, or among 0 to 5-year-olds. And so I do caution parents to be aware that while in many children it might be a very mild illness, COVID-19 can and does cause severe illness in this age group. So I encourage you to have a conversation with your primary care provider, to look at the resources that are available through a number of organizations such as the Canadian Pediatric Society and other organizations. We have lots of information available on our website so that you're making an informed decision based on the risks and benefits of this vaccine. So I'm going to move now to just a couple of quick updates regarding monkeypox. So as I'm sure everyone's aware, we did announce our first confirmed case of monkeypox just last week in HKPR jurisdiction. We, at this point in time, the most recent provincial update, which is likely posted on the website for Public Health Ontario now, we have had a total of 423 confirmed cases of monkeypox in Ontario as of today. In HKPR, we've had 2 confirmed cases and 1 probable case, which means that a probable case means that we don't have the lab result back, but the symptoms and exposure might be consistent with what we think really is monkeypox. The risk to the general population is still incredibly low. We know that right now the virus is mostly circulating through intimate contact between men. Monkeypox can infect anyone of any age, of any gender, of any sexual orientation, of any background. It just so happens that these initial infections have started within a population group that now is at higher risk by virtue of some of the activities that they're engaging in. So in response to that, we do have access to a vaccine that is can be used as pre-exposure prophylaxis as well as post-exposure prophylaxis. So if you know you might be at higher risk of coming into contact with monkeypox, or if you've been exposed to monkeypox, but you're not necessarily sick with monkeypox, then there is a list of eligibility criteria through the province. The first clinic that will be hosted by HKPR is actually this Friday in Port Hope. And so if individuals meet that eligibility criteria, they can contact the health unit to book an appointment time. And we do have some upcoming clinics in addition over the next couple of weeks to ensure those people that might be at risk of being exposed to monkeypox do have access to the vaccine, which might prevent becoming sick with monkeypox. So with that, I think I will pause and I'll open up to any questions. I'm sure I haven't covered everything today. I hope everyone's having a wonderful summer and enjoying the sunny weather. So Bill, I'll hand it back over to you and happy to answer questions.
Thank you, Dr. Bocking, for those updates. I will open it up to questions from the media. If you want to just raise your virtual hand, and then first question with a follow-up, and then we'll go around and then we can have some additional questions, repeat questions. So if there's any questions, just let us know. I don't see any there is Catherine. Go ahead, Catherine, with your first question.
Yes, good afternoon, Dr. Bocking and Bill. Hope you're both well. We were discussing at a staff meeting this morning the monkeypox appointments, and it's my understanding that all of the appointments that have been made available in Peterborough have all been booked, and there's only 3 dates for our area. Are there more being considered in case these all get booked up, or what's the uptick been for that?
So I think it's an evolving situation. As we see demand increase, we're in continuous contact with the province to look at more appointments, more clinics, and then to receive more vaccine here. The province is being very judicious in its use of vaccines, so really supplying health units once we know we have the demand and we have people coming for the vaccine. So we are doing our best to make sure that there's appointments available. So really, if someone meets the eligibility criteria, they don't see an appointment time, they should still call the health unit and we'll make arrangements for them to receive it.
What has the response been like?
So we're really just over the last week or so starting to see an increase in response. And I think part of this is when we had announced the first confirmed case in our region, often perhaps hits people a little bit closer to home once we know there is a local case and things are expanding out beyond the GTA a little bit. So we are, I think, each day starting to receive more phone calls. And again, I'd encourage people that if you meet the eligibility criteria, to please consider getting vaccinated, and we'll help you to find an appointment time.
Okay, thank you very much.
You're very welcome.
Thanks, Catherine. Would either of the other reporters present have any questions? Tricia, if you wanted to ask anything? Or Cecilia? Or Catherine? I'll make one last call. If not, we have all of our questions answered, and I think we've lost a couple. I think that's everything then. Dr. Bocking, thank you as always for your updates. They're always very informative. To members of the media and the public, we will be returning with our next media information session on the first Wednesday in September already. That'd be the 7th. A virtual Teams event will have been sent, so if you haven't received it, just let us know and we can resend it. Thank you for attending. Have a great rest of the summer, and take care. We'll see you in September.
Thank you very much, Bill, and thank you, everyone. Take care.